Calling it to order. Do we have minutes to approve? And a motion to approve the minutes of our last meeting. Thank you, Supervisor Loeb, Supervisor Sokol. All in favor?
Aye.
Opposed? Abstained?
Abstain.
Thank you, Brendan. Okay. Go ahead. Rob? Yeah.
Okay, so I just have a resolution request here. It's on the back of the agenda. This is a request to amend Resolution 507 of 2017. There was a typographical error in the amount that was listed. It was listed as $6,044, and it should have been $16,044. So to correct it on the record, I need it.
Supervisor Sokol, moving that. Loeb? Any discussion? Yes, Supervisor Leggett.
Then it's okay, otherwise budget and all.
Yeah, down below in D there, it shows what we have in the budget line, line 59,396.
Yep.
And there's a couple other things that come out of that line, but it is within the budget line.
Okay, thank you.
Supervisor Thomas, you're okay with? Okay. Yes, Supervisor Loeb.
It's just an expansion on Supervisor's Leggett's question. It's the 16,000, something like, oh, we need another $10,000 in the budget, or was the 16,000 already incorporated in the budget?
It sounds like we've got it covered in the budget.
Well, that's not the answer. Was it incorporated in the budget? I'm supportive. I'm just curious to know what
In the budget, it was listed correctly.
Okay, yeah, thank you.
Anything else? All right, we'll have the, yes, Supervisor Leggett. We have one by Sokol, seconded by Supervisor Loeb. All in favor?
Aye.
Opposed? Thank you.
Okay.
They did go
Second item is intent to fill a vacant position, mental health program analyst position that became vacant in November, and we didn't have committee meetings in December, so bringing it forward now with request for intent to fill that position.
Do we need a motion? Yes, okay. Loeb? Anyone on the second? Supervisor Leggett? Discussion? Supervisor Leggett.
Appropriate signatures, did you get those?
The form is making its way around.
Yeah, we signed it, I signed it this morning. It's due to resignation, correct?
Yes,
This one?
due to a resignation.
Right. Yeah, we just signed this. It's going through the channels.
It's up for the committee chairs.
Yeah. Right.
Okay, I'll take the vote. All in favor?
Aye.
Opposed? Carries. Anything else?
There's a number of new supervisors, and I guess I'd like to put it out to the committee that I could do a overview presentation of our office or offer that, but I don't know if the committee would prefer that during the meeting, or if we want to set up something, separate meeting for that.
I'm going to defer that to Chairwoman Frazier. Why don't you check in with her and see how she would like to do it? Yes.
If I add to that, Chair, there's a lot that goes on in Rob's department, and it would be helpful to everybody to know those details. It would be very interesting for them to hear.
I was going to suggest we do it in a meeting, the next committee meeting, set it up so give him some extra time to explain all the facets of the mental health. You're absolutely right. He does a lot of good things in the community.
Supervisor Sokol?
Yeah, thank you. No, and Rob does an excellent job with the presentation. I would almost, not to override Chairwoman Frazier, but I think she would have no problems with that. And
Scheduling
it is
it
about a
for-
15, 20-minute presentation, but well worth it. I mean, it's quite an umbrella of
Yeah, let's plan on that then.
So, I mean, if it were me, I would just, but that's up to the committee, obviously.
Yeah, I think that's fine, but let's plan on it.
Yeah, we can schedule 30
If
minutes.
she has any objections, she can...
I don't think she will.
Yeah.
it'll be
I'll
good.
still check with her, but
Yeah.
Check with her when she gets here. I'm sure she's having some rough rides over the mountain.
Yeah. All right.
Thank you, Rob.
yeah, thank you.
Have a great day.
Office of the Aging. There we go. Yes. To go with my apple.
Sure you won't.
I'll see that for later.
I mean, it'd be all right if you nibble on that up there in front of all of us, you know, it's fine.
I do have my apple up here with me. Thank you. Okay. Whenever you're ready. Yeah, we don't need to do minutes separately, do we?
Good morning.
Morning.
So I apologize, I have a little bit of a lengthy agenda this morning. The first item on the agenda is permission to submit our 2018-2019 annual implementation plan to NYSOFA. It was due on January 5th, but we didn't get the notice of when it was due until December. So we have already submitted, but we need permission from the committee. And this is our annual budgeting plan from NYSOFA.
Move that.
Supervisor Loeb, thank you. Supervisor Leggett? Any discussion? Yes, Supervisor Leggett.
Need permission from the committee to submit a report.
I believe so.
I couldn't
Oh,
hear
I'm
what you
sorry.
said.
So, the office needs committee approval in order to submit a report?
I think, I don't know.
Plan. It does include like our budget, so I think maybe that's why we go through the committee. I know it's been done in years past, and it does require the signature of the chairman of the board.
Yeah, and I believe, and thank you, Madam Chair, but I believe another reason why is because the way Guy outlined it was the, shows how much is federally funded also, so. Stipulates how much money is coming out of her budget, then how much, or rather how much is given federally and how much we have to give.
And that was the big, huge online document, several pages long, so I didn't make a copy for everybody, but it is online and available. And if you have questions, I can answer any.
Thank you. Any further discussion? Okay, I'll have the vote. All those in favor?
Aye.
Opposed? Okay, that carries.
The second item is permission to submit our 2017-2018 MIPA grant. This grant is not due until February. It did start in September of 2017, but we just actually got the application. That's why, unfortunately, I'm not coming to you till now. But this gives us monies to offset some of the salary costs of employees when they provide information regarding Medicare, insurance, information like that.
I'll move that back.
Thank you. Sokol?
Second.
Loeb on the second. Discussion? This is a grant application.
Yes.
And do we have a match?
No, not
No.
for the MIPA.
Okay. Any further discussion? I'll have the vote. All those in favor?
Aye.
Opposed? Carries.
The next item is permission to enter into a contract with the Legal Aid Society of Northeastern New York in the amount of $17,950 to provide legal assistance to our residents of Warren and Hamilton counties. We are required out of our 3B, CSE, and CSI funding to contribute at least 7% to legal assistance.
Loeb, thank you. Supervisor Loeb. Supervisor Leggett. Any discussion? Yes, Supervisor Leggett?
Any change since last year on price?
On the price, no. The only change is the vendor itself.
Supervisor Loeb?
Yes, legal aid encompasses any type of legal assistance. Is that correct?
Yes. Mhm.
Anything else? Okay. All those in favor?
Aye.
Opposed? Carries.
The next item is to amend our resolutions for our Title 3B, Title 3E, ISIP, and CSE contracts. This was to better align with the NYSOFA budget so that we could capture as much funding as possible. There are some changes in the contracts. We will no longer have a contract with Home Instead Senior Care for companion services after January 31st, but rather we'll be going with Greater Adirondack Home Health Aides. And this is due to the minimum wage increase that Home Instead is asking for. They're asking for a $2.75 increase each year. With Greater Adirondack Home Aides, we were able to secure a rate of $23 an hour for this year and $24 an hour for next year, which is still underneath the amount that Home Instead is asking for this year. We also have a couple of different rate adjustments for Hamilton County Public Health to provide some services, and a slight increase for the Greater Adirondack Home Health Aides to provide their services. But the contract amounts are staying the same.
Move that.
Okay. I'll second. Any discussion? Any questions? Sorry about that. It was a rough trip. All those in favor?
Aye.
Opposed? Carried.
Okay. The next item, we, at last committee back in October, I let you know that I was going to be putting out an RFP to have a different vendor take over the production of the meals for the Glen Falls Queensbury area.
Right.
As a result of that RFP, we would like to enter into an interagency agreement with Washington County Office for the Aging in the amount of $5.55 a meal. If you look at this page here of your packet, it will show you what our current cost is to provide the meals by doing it in-house, which is approximately $6.55 a meal. And if we go with the Washington County Office for the Aging, it would be $5.55 a meal, which would be an approximate savings of $74,000 a year.
Wow, pretty interesting, huh? All right, so I'd like to make a motion to approve that. Sokol, seconded by Ms. Bramer. Any discussion? Any questions?
A question of wondering on the quality, looking at the menus, they all look wonderful. Have you tested them?
We have not tested them, but Washington County has been doing it this way with their jail location for over 15 years, and they have not had complaints. They've passed all of the NYSOFA regulations, inspections, and whatnot, so I don't believe it would be an issue. If we do have concerns about the actual meals themselves, we can bring it up with Washington County, and I'm sure they would be happy to adjust it. We have a very good relationship with them.
We aren't going to know till we try, right? Bill?
One other question as far as the actual meals themselves. I know there was a lot of discussion 5-6 years ago about whether this program should be expanded, maybe it should be cut back. I can't remember the name of the program.
The home delivered meals.
The home delivered meals, but there were also meal sites.
Congregate.
Right.
Is this the same program?
Yes. Yep. If you look at our funding and the AIP application that we submitted, which is our NYSOFA information, we overmatch for our meals program. For the home delivered meals, it's 90% that we match, and we're only required to do 10%. For the congregate meals, it's 54%, and again, we're only required to do 10%. So we are trying to find ways to save some money, but still providing the service and doing it the same way. And this would be one of those opportunities.
Thank you.
You're welcome. Any other questions? All right, all those in favor?
Aye.
Opposed? Carried.
As part of that, We would have to amend our table of organization. We have currently 6 employees at the Cedars Meal site. 3 of them would be let go, and 3 of them would have their hours reduced. So that's number 6.
I'd like the motion to bring it to the floor, please. Supervisor Lowe, seconded by Supervisor Bramer. Any discussion, any questions? Mr. Lowe?
The Cedar site is Warren County,
Yes.
Warren County employees, and the Washington County site would be Washington County. Are there opportunities for the employees that you say we would let go? Are there opportunities within the county so that we're not throwing them out on the street? I understand the cost savings, but still someone's livelihood.
Dee, any response to that?
As far as them going to Warren, or to Washington County, I believe they're utilizing the staff that they have now, as far as, and as well as members of the jail, the individuals that are there to produce the meals. So I don't think there is an opportunity for them to go over there. As far as within our program, there's no opportunity for them to be incorporated anywhere else. I don't know about anywhere else within the Warren County offices themselves.
Yes.
What was the cost, what is the cost of employment for these 3 people?
Well, the overall employment cost for the Cedars Meal site is $252,000 and an additional $18,000 to cover their benefit time.
$280,000 for how many people?
6 people. I did have Jackie do an analysis for an approximate idea of how much the unemployment would cost, and I believe it was around like $48,000. So we wouldn't really see the cost savings this year, but next year we would, as far as unemployment costs would go.
Right. Any other questions?
Am I reading this right? Is this a reduction in hours? Is this the one we're on right now?
On this
Table of
one, it says
organization
specifically Cedars on it.
to reflect changes at Cedars Meal site?
Yep, there would be 3 positions that would be deleted,
Okay.
and 3 positions that would have their hours reduced.
And even though we're no longer contracting with Cedars, we still be employing Cedars?
We still have some staff members because they still have to actually be at the meal sites to receive the meals
Okay.
and put them in the coolers to go out and be distributed, and then also to go to the 3 locations that we have congregate sites at.
Okay.
So that's why we need those 3 employees.
Okay. Any other questions?
Just
Hello.
to kind of beat this horse, people talk about government waste and government spending, and really any penny that government spends really goes only one place, into somebody's pocket for raising their family and staying alive. So it's January, the weather's miserable, this is the routine of all businesses and government. Now's when we're going to make people unemployed. So I'll ask the question again. There may not be something in your department, Deanne, but are there avenues that we open up so that we're not throwing people out in the street without at least some consideration of, well, let's see if we can find something within the county. Now, these days, 15 years ago, there were more avenues available.
Well, I think one thing we need to remember, though, is Dee was asked to take a good hard look at her budget and see where she could make cost and make savings. So basically, she's done what the committee had asked her to do. And I understand the hardship with the people losing their jobs, but she was doing what she was instructed to do to find ways to save money on her particular budget. So I can't answer for can we find jobs for those people out there. I just want you to be aware that Dee was following through on what she was asked to do with her budget. Ms. Bramer?
Thank you. The other comment I wanted to make is that the contract doesn't start till March 16th, so are we letting these people know, and do they have time
Yes.
until then?
We will actually be visiting the meal site today to talk with them. We have been working with Jackie and with Trish to figure out what is incorporated with all of this. So we are going to give them, a heads up to let them know. And it is anticipated that we're going to do this the end of March, beginning of April, depending on when we can get the contract finalized.
So it's not like we're letting them go when you visit them today.
Exactly, no. And they do, because it's the beginning of the year. Most of them actually, a lot of them have their vacation time that they've gotten at the beginning of the year, so they will have some time that they will also actually get paid out as well, unless, of course, they use it before the new contract starts.
All right? And you're welcome. Any other discussion? All right, all those in favor?
Aye.
Opposed? Carried.
The next item is permission to correct the table of organization for 2 positions that we have. They were just listed incorrectly. The first one is at the Wells meal site. The hours should actually be only 25 hours a week, and that is what that employee is currently working. And the next one is for the Lake Pleasant meal site, to reduce those hours to 20 hours a week, and again, that's what she was currently working. So there's no effect in their salary or anything, it's just amending the table to reflect what is actually accurate.
A motion by Supervisor Bramer, second by Supervisor Sokol. Any discussion? All those in favor? Aye. Opposed? Carried.
The next items, I just wanted to bring you guys up to date on a couple of things. Our Lake Pleasant meal site, the employee that was at that location retired, resigned, effective the beginning of the year. Instead of actually filling her position, what we did is we had one of the employees from the Well site, where they actually produce all of their meals. She is driving them to Lake Pleasant, staying at the Lake Pleasant site for the people that come in for the congregate meal, and then leaving and going back. So there's going to be an approximate cost savings there of about $19,000. And that did not affect anybody's employment.
All right, good.
The second item is our Bolton Warrensburg meal sites. One of our employees at the Warrensburg meal site took a position at Countryside in the activities department. And due to the low numbers at our Bolton meal site, we transferred one of the employees at Bolton to Warrensburg. So again, we didn't eliminate any positions, but we're going to be seeing a cost savings of about $17,000. For both of those positions, we're going to keep them in the table of organization in case the number of participants coming into the site or the number of home-delivered meals out of each of those sites goes up, and we need to have an employee go back.
All right, good.
The next item is we are accepting nominations for our Senior of the Year. These are due February 19th. These individuals are actually recognized by the state. We have a luncheon for them. It's something very nice. So if there is a candidate that you guys would like to recommend, you can go on our website, and the newsletter is the nomination form, and you can send it to our office. And this is both for Warren and Hamilton County.
Okay.
And the last item I just wanted to update you on is we had our annual evaluation by NYSOFA, the New York State Office for the Aging, back in October. This is an evaluation we have every year. This year, the 3 items that we had to do corrections for was our first one is the client and unit comparison. Basically, this was discrepancies in our peer place data entry system. It was how we coded things. Instead of doing it under one thing, we were doing it under another. When we did our peer place training, they have a weekly update. We found out the correct way that we're supposed to be doing it, so we switched it over. The next item is our assessments. Any individual that we provide services to on a regular basis, we are required to do an annual assessment for them. With our ISEP contract, which is the expanded in-home services for the elderly program, where they go in and they actually do help with personal care. It's a contract agency that we use. They did their assessment at the 368-day mark, and it needs to be 365 days. The lady unfortunately was in the hospital, so they couldn't do it in time. So that was the second issue. And then the last issue was our ISEP documentation. Anytime we have an individual that is getting an auxiliary service, which is the personal emergency response system like Lifeline or Medical Alert, we have to have an agreement with them that they understand that when they no longer need the service, they have to return the equipment. These agreements had not been signed prior to my coming into the department, so we got those signed, and we know from this point forward to make sure that they're signed for anybody new. Other than that, the annual evaluation went really well, and the staff at NYSOFA are doing, the Office for the Aging are doing a really great job.
Oh, good. I appreciate you bringing us up to date on this so that we really know what's happening. I'm sure that Claudia welcomed all the new supervisors.
No, I didn't.
Oh. Well, I just wanted to say
Sorry,
welcome,
guys.
and if you
Welcome.
have questions, Dee is more than willing to answer those questions, so feel free to go to her. Anything else, Dee?
The only other thing is I gave all of you this document here. It kind of goes through the different programs we have at our agency. It tells you how much we get from the federal, the state funding, and then it tells you the maximum amount that we get from the federal or state. And this is kind of why we amended our contracts, because we were overmatched in like 3B and CSE, and we wanted to make sure that we utilized our monies as much as possible. So now we're just getting the bare minimums. We're at the 10%, the 25%, whatever we need. The only area where the county overmatches a lot is the food program, the nutrition program.
This is a good idea. That way everybody knows what's involved with your department. I think that's great.
Very complicated.
And would that be the Title III C2, Home Delivered Nutrition Service?
Yes, that's just the home-delivered meals themselves, and right above it you see 3C1, that's the congregate program, so that's when they actually come to the site. And with that program, we also get additional funding through NICEP and through WIN for those two, for the home-delivered and the congregate sites.
All right.
And the extra one right there.
Any committee member have anything they'd like to bring up? Supervisor Sokol.
But there's a lot of nice check marks in the nice box for the evaluation process, and there's a lot of cost savings, and I just want to say the job's done, or Dee's done a nice job going from Countryside to OFA. It's been about a year now, hasn't it?
There's been a lot of work involved, and I know it was quite the learning process, too. I've talked to her a couple of times, and yeah, I think she's done a wonderful job, so I should recognize her for that. All right, anyone in the audience have anything that they wish to bring up? If not, then I guess we're finished with this particular committee meeting, and thank you very much, Steve.
Thank you, Dee.
Yeah, this is good, and then he'll get with you. And I just said, I think it's important right now, because he does so many things.
Oh, I do too, and it's a good way for them to find, just like this sheet's wonderful.
But I will get more of that.
Countryside, they will appreciate the good job next week.
This thing coming out,
Oh, yes. Well, I was partly
and that was a good point. When I just being self-employed for 35 years, nobody came back to my board and said, hey, look, is there anything I can do to help you out? Why, you know, you're living paycheck by paycheck, but things weren't going, you know, the way they used to, and everything else, and, you know, it's the way of the world, and I hate to do it, but as I just said, you know, they're asking the country.
Oh, I had a
We've given some time, and, you know, they do have the option of...
But as long as we're not interviewing.
Sometimes...
Yeah, I got one big problem. The county did that.
That's the rule. Yeah.
I'm not gonna
Nope, we can't change on that one.
say that TSS.
Thank you.
I don't wanna vote. I should be.
Nobody in the room.
We could certainly interview them if they wanna
Right,
get a part of it.
then they can do that too.
Have to be in the county.
Blase about this.
Why does it have to be so complicated?
Don't worry about it.
We all set?
Yes,
Good morning.
Good morning.
You're getting close, Maureen.
Yes, today is my last day.
That's what I thought. Wow, good for you.
Monday was your last day.
No, Tuesday's my last day.
Next week.
No,
today.
Today.
Oh, okay. Well, rest up for the party.
So we'll begin.
Yes, we'll begin.
Our first thing is request resolutions to fill vacant positions. Our social welfare examiner 32 in the Medicaid unit resigned effective December 2nd, 2017. Is one of our social welfare examiners. There's another one in the temporary assistant SNAP unit, and that person retired effective January 9th. Another social welfare examiner in the temporary assistant SNAP unit retired also. That will be effective January 27th. The fourth social welfare examiner in the temporary assistance and the SNAP unit retired effective will be retiring effective January 30th. And then we have caseworker 10 in the foster care unit due to retirement effective January 12th. We've had a lot of retirements.
Boy, I guess so.
Move all 5.
Okay, and second to that, Supervisor Loeb. Discussion.
Thanks.
Ms. Framer.
Yeah, is anyone left in the office?
Yes, there are people left in the office, although we are having a lot of problems with the flu right now.
Oh,
It's been going through the department in the upstairs and the downstairs floors, so we're trying to be supportive and trying to encourage people to wash hands, and we ask them to come over and spray some things when we were not in the offices, because it really has hit us hard. So, for the flu, plus retirement.
Yeah.
right. Question, Supervisor Loeb.
Yes, I'll add to Supervisor Raymer's comment that it's nice that we're acting on this now, because while we're voting on it, there's a hole in the service level because there's training. You have to hire the people, and they have to be trained. And meanwhile, the people who are remaining have to pick up the slack. There's a lot of work to be done. I think we're jumping
True.
on it now.
Right. I appreciate it.
Any other discussion, Supervisor
Just,
Framer?
one more comment. Any notables in our retirements here in this? And anyone?
How were they?
Like how many years they've had with the county? And
We had one of the people retiring had, for the SNAP unit was 15 years. The other two in the SNAP unit were 22 years, I believe. So they were long-time employees that served us well. And while I'm on this, I think I would just tell you the other day, I got a card in the mail from a woman that came into our office. She said in her darkest moment, she came in, was treated so respectfully and nice by people in our, let me make sure, Medicaid and our SNAP unit and our temporary assistant unit and the people on our front desk, that she was just so grateful. It made that moment in her life so much easier. And I think that's what we're all trying to do as a department, is to serve people in respectful ways, so that, and understanding that it is a very hard thing to come to the department. So I feel that as really good. That is what I want to see. I wanted to see over my career that we made sure that people in pain and in trouble or without resources were treated kindly, respectfully. And I think we have achieved that, and it's wonderful.
Absolutely, speaks well for your department.
Yes,
Mhm.
I have excellent workers that understand that. I appreciate it.
Terrific. All right, all those in favor? Aye. Opposed? Carried.
Okay, my second request resolution is to amend the 2018 county budget to increase revenues and appropriations in the amount of $30,000 to reflect the receipt of SEY, which is Sexually Exploited Youth Program funding for preventive programs. And both Cynthia and I have been here over the last few months talking about this program, and we're just accepting the money from the state now so we can change our budget a little bit. So,
All right, someone like to make a motion? Supervisor Loeb, seconded by Supervisor Sokol. Any discussion? All right, all those in favor?
Aye.
Opposed? Carried. Thank you.
And our next resolution is a request to extend the date which deletes the position of resource assistant from January 31st, 2018 to March 31st, 2018 due to the need to replace the vacancy for the position of resource coordinator. We're still searching for an appropriate person, and so we are very lucky that our past person has come back from retirement, works about 2 days a week for us. And it's a very important unit because they bring money in, so we're going to do that.
Okay, so a motion by Supervisor Loeb, seconded by McGowan, is that right?
Yes. Thank you.
All right.
Just don't call me late for dinner.
Okay. Any discussion? Supervisor Leggett?
Yeah, so this deletes the position, effective date. What's
It's, we're requesting to extend the position that would have been deleted.
Gotcha, thank you.
Okay?
All right.
So we could just hold it open till we get, our search is complete and we have somebody to fill it.
Now, isn't this the one that didn't follow the line of progression over there? Is this
Yeah.
the same thing?
Yes, that is the position.
What happens on some of these positions? They had some people who wanted to apply for the position, but because of civil service rules, if they got the position, didn't like it, they wouldn't be able to go back to their old position. It's my understanding. It's a civil service quirk in the rules. It's not like the line of progression. This is out of line of progression of some of these appointments over there. So they had some people apply, and they had some people who didn't apply for this very reason. So we're straightening it out and we're reposting, but if somebody doesn't like the position, they don't have the opportunity to go back to their old position. It's a civil service quirk.
Right, because it's not in the line of promotion. It's in a different unit entirely with somewhat different responsibilities.
So that's why we had to redo this.
Okay.
All right.
Interesting.
Any other questions? Supervisor Loeb?
Just a clarification on what you just said.
I wish
We
they
had to repost because someone wanted to go back to their old position?
What happened is, some people understood the rules and some people didn't understand the rules. We had one person who didn't agree with the civil service rules, and we explained it to them. So in all fairness to all the candidates, we're reposting the position. So they all know that if they cannot have rights to go back to their prior job. So that's the way it was explained to me. So it felt better to be fair and repost.
All right, are we good on that? All right, all those in favor?
Aye.
Opposed? Carried.
And then we just have a main item, which is the committee authorized the Personnel and Human Resource Departments to proceed with the advertising the Commissioner of the Department of Social Services position for the month of December, leaving this salary to be determined. So,
We're working on that.
I was going to say, we're working.
We have some,
We do have some...
we have some resumes that we potentially will discuss this afternoon in personnel.
All right.
that takes care of my part, and we'll go to, countryside first. Back to Julie for the rest. Sure, but,
Yes.
How are you, Edward? I'm fine, thank you.
I think it was.
Well,
I don't agree with that. I follow
It's a
it.
little easier to read it here than on the computer.
I agree.
Open it up.
Peter did email me, said good night.
Thank you.
Oh,
contentment.
She didn't remain with
Without its 40 ended up with 70.
What's on the menu for Friday? What's on the menu for Friday?
Morning.
Good morning.
Okay, we do have one action agenda item, a resolution request to renew our contract with Hudson Headwaters Health Network for the provision of physical exams for the employees of the home. Resolution number is based on the original contract number, R479-2015. Have the address and the contact information. The commencement date of extension is January 1st, 2018. The termination date would be December 31st, 2019. The hourly rates, we were still able to renew it at the same rate, so there was no increase. It's $100 per exam and $15 per PPD. And the budget code is A6030-435. So we're requesting a renewal of this contract.
All right, I need a motion to bring that to the floor. Supervisor Sokol, seconded by Supervisor Loeb. Any discussion? All those in favor? Aye. Opposed? Carried.
Thank you.
Mm-hmm.
And we have the admission discharge report. For November, we had 2 admissions and no discharges. In December, we had 4 admissions, 1 discharge. Currently, we have a census 35 long-term residents. We did have 1 respite resident who came in for a 2-week stay, and the resident and the family liked it so much, they decided to stay full-time.
Oh,
So
good.
that brings us up to 35.
Great.
And then we have the overtime report. Glance through that. If you have any questions.
Anyone have any questions for Edward? Supervisor Loeb?
Yes, thank you. Looking at the census report, 35, in fact, not only has it not changed in the past 8 years, but it actually looks like it's gone down. Have we entertained any different marketing approaches?
We've been doing it right along.
Right. We spent a lot of time last year looking into that, trying to figure out, Edward can vouch for that. He spent a lot of time trying to figure out a way to get enrollment up.
We have developed a comprehensive plan to promote the home, and I would be happy to discuss the specifics of that with you. If you want a report, I'd be happy to send it to you and meet with you, the committee, to discuss it, go over everything. I'd go from there if you want. I'd be happy to do that.
Perhaps I'll go up and visit
I think it's
sometime.
wonderful. I went up and spent an hour. It was great to just see how everything,
Be happy
yep.
to go over everything and show you around and let you know what we're doing and welcome any input anyone else may have.
I'll be in contact. Thank you.
Look forward to it.
All right. Guess this is,
I'm sorry, I just have a question about the capacity of the countryside. So it's right now we're increased at 35. What's the capacity in terms of number of beds or rooms? And what's the capacity for the staff?
Well, the capacity for residents is 48, okay? And then,
And my question was really, can you handle that 48 with current staffing levels?
yeah, well, we'd have to look into that. We might need a little more here or there, but I'd have to look into it a little bit more. Obviously, that's the goal, you know, obviously, to get more residency, eventually get full or get close to full without, you know, running out of 20 more people, you know.
anyone else? All right, thank you, Edward. Doing a good job up there.
Thank you. Have a good group.
Good. Makes a difference.
From Manhattan.
Julie, I guess it's your turn.
Okay, wrapping up 2017, our overtime report for 2017, we came in about 380 hours over the previous year. It's not something we have a lot of control over. Lots of calls and reports and We try to keep it as minimum as possible. However, it's really tough with the mandates that we have, which is setting it up for next year because, as you know, the training involved alone is
Right.
going to add a lot of overtime
Right.
in the beginning of the year with these new hires. And then my expenditure and revenue report for 2017. As of when I ran this report on the 23rd, it looks like we are under budget by about $3 million. However, that's deceiving because we are furiously paying bills in January.
Right.
We should come in under, but we are going to make a big dent in that $3 million. And if you multiply the 3 million times 75%, which is what our approximate reimbursement is, the revenue piece of it would be $2,250,000. That's what we would get on that $3 million, and that's almost exactly what we're short in the revenue piece.
Right.
That takes a lot longer to come in because what we pay right now, this month, we will claim in February, and we'll get the reimbursement on it 3 months later. So we're not going to see a lot of this reimbursement for several months. But in general, it should all come out so that we are a little under budget and the revenue should match.
All right, sounds good. Any questions? Supervisor Leggett?
Do you keep the books open that long for 2017?
We do, with the treasurer's office, we do an estimated accounts payable and an estimated accounts receivable.
All right.
I think I'd just like to add that our numbers, I think, in overtime were up because we had about 200 more reports this year.
Wow.
Yes, than last year. At least. So we keep, and we see that continuing. We're very concerned about it because it's very tough for our CPS workers to keep up. We spread some of the other work when we can to other units or secondaries or that aren't as intensive, but we're still struggling.
Right.
Actually, is there a reason why there's such an uptick in child protective services?
We don't see a real reason. I think it's at first, and I've asked John and Tammy, who are Tammy, of course, is our grade A. John is a supervisor. They don't see that there's one single thing that's causing it, and they did also see, I said, is the register, accepting maybe things that aren't actually reportable yet, they don't reach that level, and they said no, the reports that they're getting are, they think should be called in so they can be checked out. So, we're in that.
Claudia?
Is there any sense that it's coming from, like, opioid addiction problems or lack of resources like food or transportation or, like the underlying...
What has Maureen said, there's really not one
No.
certain thing. Yeah. Overall, the reports to the State Central Register are up every single month for the past year, just about.
Are we looking to see if we are comparable to other counties? I mean,
As far as numbers
yeah.
go,
Or the uptick, not necessarily sheer numbers, but...
yes, I think it's comparable across the state.
Huh.
I don't know percentage-wise exactly, but I think everybody's up. Everybody's clamoring for more positions.
Any other questions? Well, I would like to thank Maureen for her many years of service. I wish you the best in your retirement. I remember when I did your evaluation, you said your big thing was you were passionate about what you do, which I think shows through, and I think that's wonderful. And I do wish you the very best. Enjoy your retirement. I think the committee wishes you the same. I just want to make one other comment that Cynthia is here because she will be filling in for Maureen until, we pick someone else to replace her. So I just want you to feel that if you have questions at that point too, you could touch base with Cynthia. Cynthia, I didn't know if you had anything you wanted to just say real quickly, or...
Well, I'm not sure what you mean about filling in.
Well, I mean, you are the deputy. Well, I mean, you are...
She does fill in temporarily until we, if it's going to be long-term, we would have to send her qualifications into the state, but I don't think it's going to be a long-term. We're going to try to move the process to fill Maureen's shoes as expediently as we can. So I don't think we really have to do anything on a short-term. She's the deputy and she would fill in.
Okay.
And I'd just like to add, Maureen, she's been great to work with, and I've enjoyed it, and we've had some good times, and we've had some difficult times over there, but I think Maureen has stood up to the task, and I'm going to miss you, and you've done a great job for the county, so thank you.
Thank you, Marty.
Thank you.
I appreciated all the times that I've worked with all the members on the board. I appreciate all my staff that has done so well, and really, I love working with people in Warren County, and we've changed a lot of lives with the help of the department, and that's what it's all about, is to help people become more independent and take care of their children, and to help our older population too. So, and I appreciate that I was given the confidence vote to do that. Thank you very, very much.
Thank you.
I'm pretty well so far. Yeah, we don't need to do anything.
Well, now I have the calendar in mind.
We checked.
So,
So you don't want the job?
Thank you. Thank you very much.
Yeah, I don't even know.
You tell us if you don't want to do it, then we'll have to do something good for it. That's according to the state. It's just a short term. And we don't have to.
You didn't take your leave this morning?
Well, I would say we're going to talk about resumes.
Yes, that's correct.
I remember it.
I'll
On my desk. Yep, I'll do that. Girl, I was a little nervous.
Thank you.
They bring more souls.
Hey, how are you?
We're out. They're down there.
We do make progress every now and then, so.
I supervise.
It's one of those things that they're playing with.
Absolutely.
And there was a comment that came from citizens that are directed at that.
Well, I'm going to get some stuff done before I leave.
Violations, zoning violations getting into place.
Good morning, all. We're ready, Pat.
Good morning, everybody. First thing, on our agenda, we'd like to welcome all of our new people, and also welcome back our people that have been with us before. We're happy to have you here. We are also planning to set up a tour and orientation for our department for anybody that would like to come.
Good.
And we'll be working with probably whoever sets up the schedules to see if we might be able to do it on a day when most of you are here anyway. It wouldn't take a long time, but you wouldn't have to make a special stop. And also we're hoping that even though there are some that are new, that are not on our committee, they might come as well. Okay.
Supervisor Sokol.
It's just a little disconcerting to see that it's kind of like getting orchestra pit seats at SPAC. I went from there to lawn seats on the list here.
I didn't do that.
Take your shot at the chairman, too.
I'm down at the bottom.
I hear you, though.
Would you like to change with me?
Well, we're just glad you're on the committee, Matt.
Maybe I'll list things alphabetically.
Okay.
Okay, that said, maybe for the new folks, because we come here as a team every month, and you may not know who everybody is, if our rest of our administrative team down there could introduce themselves and
Good
say
idea.
what they do.
I'm Janelle Jones, I'm the Assistant Director of Public Health.
Tom Driscoll, and I'm the Fiscal Manager.
I'm Tammy DiLorenzo, I'm the Clinical and Fiscal Informatics Coordinator.
I'm Valerie Wisnet, and I'm the CHA.
I want to say what CHA is.
The Certified Home Health part of our office.
Thank you. Without them, we wouldn't run. So, wherever you see them, be very nice to them. Okay, moving on, I guess you already did the minutes, so to the resolutions. We need to request a resolution to reappoint the members of the Professional Advisory Committee. We have to do that every year, and I transmitted the list of the folks that are on it, if anybody wants to see it, but it's like extra paper, that's very but we do have to do that for Department of Health regulations.
All right, would someone like to bring that to the floor? Supervisor Sokol, second by Supervisor Bramer. Any discussion? How many are those that you have to reappoint about?
How many committees?
How many members are you reappointing?
It's about 12.
About 12?
What we have to do is be sure that we have representation from different places, which have doctors on there. And when we get
Oh.
surveyed, they do check to make sure that we have minutes and that we really have them.
Oh, okay, good. I do remember seeing that list on the past. All right, all those in favor?
Aye.
Opposed? Carried.
We also would like to request a resolution to appoint and reappoint the members of the local early intervention coordinating council members. That list was transmitted as well.
Someone like to make the motion? Supervisor Loeb, seconded by Supervisor Bramer. Any discussion? All right, all those in favor?
Aye.
Opposed? Carried.
Okay, the only thing with that is, with the Department of Health wants to have parents on the committee, and every year we have trouble getting parents, even though it's only twice a year for about an hour. It's a good thing because it means everybody's happy, but it's hard every year to get people to be on it. Okay, moving on to, we'd like to request a resolution to amend the agreement with North Country Home Services. They had requested a rate increase for home health aides from $28.50 to $30 an hour for 2018. They provide services maybe to about 2 or 4 clients every year, and but we need them because they're in the northern part of the county.
All right, motion by Supervisor Sokol, seconded by Supervisor Loeb. Any discussion? All those in favor?
Aye.
Opposed? Carried.
We would also like to request a resolution to authorize the contract with Elizabeth Keegan to provide occupational therapy services. And we are in extreme need of occupational therapy services in home care, and we don't want to be in a position where we can't accept referrals. And they're revenue generating visits.
All right, Supervisor Loeb, seconded by Supervisor Magowin. Got that right or wrong? McGowan. I'm trying to sound it out. Sorry about that.
It's been pronounced worse, so don't you worry, all right?
I apologize. Any discussion?
Thanks.
Audie.
I have 2 questions. Do we have any OTs on staff?
Yes, we do. But because they're contract people, they can take referrals if they want to, or they don't have to if they don't want to, and particularly in the northern parts of the county, that's not particularly attractive because we pay per visit rates, we don't pay mileage, and if you have to drive from Queensbury to North Creek, it's not very financially appropriate. So whenever somebody wants to do a contract with us, it behooves us to do it.
All right, any other questions? All right, all those in favor?
Aye.
Opposed? Carried.
Now we'd like to request a resolution to authorize a new 5-year contract with Department of Health Bureau of Immunization for an immunization action plan. The dates from April 1st, 2018 to March 31st of 2023. Goes through the Grants Gateway project, and every year they give us the same amount of money. We voucher quarterly. It's a win-win, so if they're giving us money, we should reauthorize the contract.
All right. Mr. Loeb makes the motion, seconded by Mr. McGowan. Any questions? All those in favor?
Aye.
Opposed? Carried.
We'd also like to request a resolution to authorize Leah Howe to receive reimbursement for job-related course, advanced concepts in nursing practice in the amount of $695 upon completion of the course, obtaining a grade of C or better. This is her last course before she gets her bachelor's degree in nursing, and we certainly would support that.
All right. I'd like to bring the motion to the floor. Supervisor Loeb, seconded by Supervisor Leggett. Any discussion? Okay, all those in favor?
Aye.
Opposed? Carried.
We'd also like to request a resolution to amend the contract agreement with BOCES to reflect that Warren County Health Services will provide clinical experience to high school students in the New Visions program only. The contract they sent us, they put all of the programs that they offer, and we just want to clean it up to make sure that in the contract it only states what we're providing for them.
All right, someone like to make the motion? Supervisor Loeb, seconded by Supervisor McGowan.
Can I ask a question?
Yes, certainly.
Can you just explain New Visions?
It's the program that they have for high school kids where they send them around to different places, and we take them out and show what we do, and they do that. They go to the hospital too.
Okay, so it's like a mentoring.
Yeah. Had it for a lot of years. Nice kids.
Okay. Supervisor Loeb?
Thank you. Is it the same group? Like at the hospital, we would have a group that would come to the
Probably.
hospital and take their school classes plus,
Those two ones, yeah.
but they would take time out also to come to the county.
Right, they come different places, yeah.
Fantastic program.
Good. All right, all those in favor?
Aye.
Opposed? Carried.
Okay, Tanya, we have a budget amendment.
Your last page is attachment number 5. Basically what we're asking for, we got a grant last year about this time for $2,500 from the Adirondack Rural Health Network for the neonatal abstinence syndrome. We did a little seminar and conference with a speaker, and we have $413.26 left. We'd like to carry over to this year so that we can utilize that. I believe Patty Meyerberg is planning on doing another, some kind of a little meeting to go over all of this information. Janelle might know more if you want details. So I just talked to treasurers. I have to carry that money over from last year to this year so we can utilize it.
All right, someone like to make the motion? Supervisor Loeb, seconded by Supervisor McGowan. Any questions? All right, all those in favor?
Aye.
Opposed? Carried. Thank you.
We would like to request committee approval to forward a resolution request to the Personnel Committee to change the job title of long-term home care program coordinator to supervising public health nurse and to amend the table of organization to reflect the change. This is going to delete the title of long-term coordinator and create the title of supervising public health nurse. Basically, it's a funded position in the budget, and we're doing it now because and the salary is expected to decrease a little bit because the person that's been the long-term home care coordinator has really been a supervising nurse, but we're just cleaning it up. And we'll save a little bit of money, so we won't have the title of long-term program coordinator. We'll have the title of supervising public health. And this has all been reviewed with personnel and civil service. Actually, we were told by civil service we had to do it. So.
All right, motion made by Supervisor Sokol, seconded by Supervisor Bramer. Any discussion? All right. Supervisor Leggett.
And you're looking to backfill the position?
Yes.
Any other questions? All right, all those in favor?
Aye.
Opposed? Carried.
We'd also like to request approval from the committee to forward a resolution request to personnel to delete the position of senior health educator that was created and approved in the 2017 budget, and I guess in the 2018 budget. Anyway, and create the position of public health program coordinator. Both positions are grade 18, base salary $45,313. The rationale is when we were looking over this, because it was a new position, we decided that we needed to change the position because we basically would have broader ability to have the person used to both sides of the house. Look at our social media, it just seemed like a good thing to do. We'll still have our senior health educator, but the tasks will be just different enough that we need to amend them.
All right, someone like to make that motion? Supervisor Loeb, seconded by Supervisor McGowan. He wants to make sure I get his name right.
Yeah, lots of practice.
You're doing very well, I have to say. I'm very proud of you.
Thank you. Any discussion, Claudia?
Thanks. So we still have another senior health educator?
Yeah, this one would have been a second one,
Okay.
but yeah, it's Dan Durkee, who a lot of you probably
Oh,
know.
right.
okay, yeah.
All right, any other questions? All right, all those in favor?
Aye.
Aye. Opposed? Carried.
Okay, we
Thank
now
you.
have any pending items? So moving on to expenditures and revenues. The kind of thing we see this time of year when the books are closed, but why don't you give me the best updates you have?
Right, attachment number 2 is our current financials as of 2017. As Pat said, we're not far into 18, so we don't really have any numbers yet to show for 2018. 2017, we are in the process of closing the books. This is our current expenses and revenues. You'll see at the bottom, which we always try to emphasize, is the salary. It isn't completely finished. I did talk to treasurers. There are still final adjustments for health, retirement, vacation, and retirement health insurance and vacation accrual that will still need to be posted, but I don't expect those to sway the numbers too much. You'll see at this point with the 2017, we're at 86.86% of the budget, what was budgeted for 17. Our revenues are, expenses and revenues will both be adjusted accordingly within the next, month or two as we close December. If you look at report attachment 3, you'll see the comparison to year-end of last year for 2016 to where we are right now. One thing to bring attention is, just to let you know regarding revenues, we will be getting our WIC, what they call food vouchers, as we hand them out. We get a value for those from the state as what has been expensed and has been utilized. That will give us a value. We book that as both an expense and a revenue. That could be close to $700,000, is what it's been running the last couple of years. Also, our preschool program, again, the revenues for the school year started July 1st.
Right.
For this year, we can't bill that until we get the template, I guess you could say, from the state. We usually get both of those around March or April, and again, we'll book those, and then we're still in the middle of closing December. So we could have a possibility of up to almost $2 million more in revenue that you're going to see. It just won't be until the books are finally closed and we can bill those to the state. So regarding expenses, it's almost the cutoff date at the beginning of February to get all of those in. And the only thing is that our big ones, again, will be the WIC food vouchers, like I said, and our preschool program, I think the month of December. We're still finalizing those bills. So most of the big ones are in, and those are a few that will still be recorded in the year end. So in February, I'll have a better idea of where we stand. It still won't be finalized because our preschool and WIC, we won't have those numbers till March or April, but we'll be getting a better idea of the expenses.
Okay, very good. Thank you.
Okay, thank you, Todd. Moving on, you'll see in your package you got our emergency response monthly report. It's pretty self-explanatory. Provide that report every month. If you have any questions on that?
On our 2017 actual revenue, it looks like it's a lot lower than budgeted. I know you just kind of said that, but what, is that going to catch up?
It's not going to catch up because our expenses are lower too, but like I said, we're going to get almost, I'm estimating we could get up to $2 million more in revenues. The big ones are our preschool program and our WIC food vouchers. WIC, when we get from the state for the grants, we get those on a monthly basis. But food vouchers is something that we record. We have only up till October to state. They wait until all the cash is cashed, so we can't get those until March or April. They might run both of them around 700,000 to 800,000. Last year, I believe our preschool was 800,000. Our food vouchers for WIC was around 700,000. And then we still have to close December, which could be another 300,000, 400,000. So I'm estimating that we could see at least another I know it looks like another $2 million. And you won't see that much in expenses.
Did we reduce our revenue for 2018? Our revenue outlook? I think we did, right? Some?
I think we did some, yes. When you're midway through the year, you try to see where you've been and where you're at. And again, at least with the preschool program, the big thing is you just don't know what kind of cases we're going to get, whether they're going to be ones who need full benefits and get a full speech, OTPT or kitchen assisted speech. And again, it all depends on the mix of what we get.
All right. Thank you.
Okay, thanks, Josh. So, emergency response, I guess we can talk about. Answer questions. Status of referrals, looks like we've been awful busy. I was surprised to see that it was down a little bit, but that could be, school season maybe didn't kick in yet. Now, do you have comments on?
No, we've been very busy. We have had, unfortunately, two of our per diem nurses, as within their right to be in a per diem, have accepted full-time positions elsewhere. So our nurses have been busy because those two per diem nurses have worked, pretty often. So that's one of the things there. I know the census at the hospital, they tell me, have been down. But we're busy. And, we still have not, had to refuse any patients. Nurses may not always like it in the sense that they're just so busy, but...
For our new people, just so you don't understand why we have to sheet with a lot of numbers. A few years ago, we didn't have any competition with other agencies. So since we had the competitive agency, we just like to see where we are, like somebody grabbing all our referrals. And we hold our own. We ebb and flow, but this provides a really good visual of where we are. So that's why you'll see that every month. Okay, staffing update for our new members. You should understand that our department struggles with nursing staff recruitment, as does every place. I mean, there's a lot of people that, like many other agencies, we have an aging group of nurses, and when they retire, it's not easy to seek replacements, and sometimes it takes a while. But the thing in our agency that's really wonderful and has served us well is that most of the people that retire want to come back per diem, which is great because it's cost effective. They can work on their own terms, and if they want to work 3 days a week or 4 days a week, and if we don't need them, we don't call them in. So it's a real win-win situation for us. So right at this moment, everybody seems happy with working with their per diem, so hopefully that's going to be good.
All right.
Let's see. Since our last meeting, we had one registered nurse who had about 25 years longevity retired. She's hoping to come back on a per diem basis if her health allows. I don't know how that's going to go yet. We certainly hope she can, but we need to backfill that position, so there was a sheet that went around for that.
We need a motion
What was that for?
for the,
Oh, okay. We're going to need a
That's what I'm talking about. Yeah.
Okay, you finished up, yep, and then we'll act on it.
Also, I think there's one for a WIC nutrition facilitator, and that's a part-time position, fully funded. And that person came to us after she got out of graduate school. We really didn't expect we were going to keep her very long. She got away to have a job, so she's gone, and we wish her well, but we have to backfill. That's welcome to the world WIC.
Oh, I'm sure that's true.
Let's see, we are also, as we talked about before, looking to hire a supervising public health nurse to backfill the retiring long-term supervisor, long-term care supervisor position. That one has New York State qualifications, and it may be a challenge, but we've got a couple of interested people, so hopefully that's going to work out.
Okay, we need to go back. We need a resolution to approve the intent to fill the position of a registered professional nurse, correct? Is that what? And we also have, we put those both together?
Yep.
Okay, and to fill the WIC nutrition facilitator position. So someone would like to make that motion? Supervisor Loeb, second by Supervisor Leggett. I think Pat's explained those to us, so, but if you have any questions, now's the time.
Did we already approve the backfilling of the supervising?
Yeah, that's what I was just going to say. I was told that I couldn't send the sheet up until I got approval to change the position, which seems to me like it's going to waste us a month. But because we don't have an actual person coming in, we probably will be okay until next month, so we can do it that way. So
let's just approve that now.
You're talking about this one back here,
Yeah.
the public
All
supervisor?
right, well, we need to act on, first of all, let's act on the resolution that we brought to the floor. Any other questions on those two positions? All right, all those in favor? Aye. Opposed? Carried. Claudia, what is it you want us to act on now?
Well, it looks like it's on here twice, right? This,
Yeah,
the
change the
backfilling,
title.
we changed the title and then we want to backfill the supervising public health nurse. This is,
Civil services, that civil service was the one that said until I got the permissions to actually change this, but if you want to do that, I would love that.
Yeah, I'm gonna
move it on to
move it.
personnel.
oh yeah, that's
So is
fine.
it,
Okay.
We'll move it on to
civil services?
personnel.
Move it
All
on to
right,
personnel.
so we need a motion then to fill it. If you want to do that now, then I'll accept that.
Yes, or move it to personnel?
Okay?
Okay, yeah, both do both,
And
yeah.
then a second to that motion? Okay, and then you have a question?
Yeah, county attorney.
Oh,
I was just saying, you can do that here.
okay.
Just because you have the approval, I mean, you have it, that way you have it moving forward. It doesn't have to go in a certain process.
All right, so, question, Bill?
I think it'd be better to minimize the discussion, to move it here.
Yeah.
rather than have to
I think it
explain all
still
this.
has to go to...
It still has to do the loop.
Personnel, because they deleted, created that
Sure.
position, so I think it will show up in personnel.
All right, so, all those in favor?
Aye.
Opposed? Carried. Took care of that one, Pat.
Okay, the last thing I have is just to let you know I am planning to retire the end of March, and I did have some conversation with Edna, and I had some conversation with Kevin, because I'm sure there's a process, and I found out that there certainly is a process. I will tell you, whether I'm allowed to say it or not, I will. My fervent hope is that maybe Janelle will be appointed to that position, because she's certainly been here a long time and has all the qualifications. She's been here since 1994, has the state will sign her off tomorrow, but I certainly understand the need for the process as well. We're happy to go through doing that as well. So I guess as time goes on, I think there's plenty of time, and my hope is when I shut the door and somebody else opens it, there's not a bleep, and that's my goal for last year, and my goal.
I think you've done a good job of kind of trying to move us in that direction. You are going to be missed, but again, it's retirement time and you should enjoy it.
My kids are telling me I'm a fossil.
Most kids think they're parents are anymore. Okay. Oh, thank you. All right, any questions from the committee? Oh, then I'll entertain a motion to adjourn. Supervisor Sokol, second by Supervisor Bramer. All those in favor?
Aye.
Opposed? Carried. Let's actually do pieces.